Hello and good day, everyone. My topic will be on obsessive compulsive disorder. In this topic, I would be presenting the concept behind my infographic poster, the definition of OCD, its main subtypes, the statistic, the causes, treatments, and the related disorder of OCD. I start by giving a quick overview of the concept behind this poster. So why pink? People with OCD often avoid the color red, so I chose pink because it combines all the intensity of red with the purity of white, leaving us with a shade of gentleness and affection. Pink also represents youth, good health, and joy. In this poster, the meaning of OCD is categorized into two parts. We can see that the subtypes of this disorder is the highlight of this poster. And all the graphical images are used to represent the informations. According to the definition of this disorder, it's a mental health condition that involves two situations: obsession and compulsion. Obsession means involuntary thoughts, images, or impulses that occur over and over again in your mind. You don't want to have these ideas, but you can't stop them. Unfortunately, these obsessive thoughts are often disturbing and distracting. For someone with obsessive thoughts, the symptoms will be involving unwanted thoughts or ideas that will continuously disrupt their life. On the other hand, compulsion means behaviors or rituals that you feel driven to act out again and again. As for someone with compulsive behaviors, the symptoms will involve forcing them to perform repetitive behaviors or action in response to obsession. In rare cases, people with OCD have either obsessive thoughts or compulsive behaviors, while most of them have the combination of both. Looking at these main subtypes of OCD can help you identify and connect obsessive thoughts and compulsive behaviors. So the first type of OCD is cleaning and contamination. If you are affected by this symptom, you will usually focus on feelings of discomfort. You'll have persistent worry about germs or sickness, where the thoughts about feeling dirty or unclean, whether physically or mentally, keeps on emerging. You may wash or clean items excessively to reduce these feelings of distrust. These obsessive thoughts will lead to compulsive behaviors to wash or clean contaminated items in a specific way, or repeated rituals, such as washing your hands or scrubbing a surface a certain number of times. Next is related to obsessive thoughts, which is having frequent intrusive thoughts that are often sexual or violent, leading you to feeling guilt, shame, and other distress about your thoughts. You will have persistent worry that you'll act on your intrusive thoughts and harm yourself or someone else without meaning to, or thinking that having these thoughts makes you a bad person or being disrespectful towards your religion. When you have these involuntary thoughts, you may often use mental rituals such as reciting particular words or praying to relieve the anxiety you experience. Some people will act on compulsion and lock themselves up to avoid harming other people, or frequently reviewing the daily activities to make sure that they haven't hurt anyone. And then there's symmetry and ordering. It is when you have a strong need for things or belongings to be aligned in a specific way because you feel incomplete if they are not. For example, you might feel the need to constantly arrange your shirts so that they are ordered precisely by color. Finally, there is the checking compulsion. If you have these symptoms, you will frequently have severe thoughts about possibility of harming yourself or other. You use checking rituals to relieve your distress, such as constantly checking locks, alarm system, or such, or thinking that you have medical conditions when you actually don't. Going by the statistic of this disorder, US studies has shown that OCD has a lifetime prevalence worldwide, that it appears in between 2 to 3% of the population. Lifetime prevalence means the proportion of a population who has ever possessed the disorder at some point in their lives. According to my inquiry, there is no updated or current information on OCD statistic, but I believe that they will continue to rely on the lifetime prevalence data unless they see a change in the numbers. The information about OCD in Malaysia is actually uncertain due to a lack of sources. But based on the National Center for Biotechnology Information, OCD has affected 1 to 2% of the population in Malaysia. From Astro Awani Malaysia News, related to OCD, they've once stated that this condition affects both men and women in about equal numbers. But males tend to get the disease at a younger age and have more severe symptoms than women. They also state that the majority begins at a young age, with 2/3 of them beginning before the age of 25. And here is the graph on the median age for disorder to occur based on the reference from a study of disorders. The factors that cause this disorder to occur is including family history, where having parents or other family members with the disorder can increase your risk of developing it. OCD may have a genetic component, but specific genes have not yet been identified. There's also a biological cause to this disorder relating to the changes in your brain that may be a result of changes in your body's own natural chemistry or brain functions. For environmental factors, people who are already prone to OCD may be triggered by stressful life situations. People with OCD frequently report suffering from a stressful or traumatic life events before the onset of the symptoms. For example, a traumatic brain injury in children and adolescents has been linked to an increased chance of developing OCD later in life, according to research. As for the OCD treatments, it does not completely cure the illness, but it definitely controls the symptoms. The treatment of obsessive compulsive disorder include psychological therapies and medication. Choosing a course of treatment for OCD depends on several factors, such as what's your attitude toward medication, and what's the severity of your symptoms, and the presence of other disorder, and your motivation to undergo either the exposure response prevention (ERP) or cognitive behavioral therapy (CBT). ERP is specifically designed for OCD. It motivates you to address your obsession and resist the temptation to act on them. It is a type of behavioral therapy that involves exposing patients to situations that may trigger their obsession and discomfort that comes with them, as well as aiding them in avoiding compulsive behaviors. While CBT is to identify the patient's mental processes, adjust their mind to thinking of the situation and respond to it positively. For medication, it is suggested that different ages of people take different types of medicine, but there are common ones such as antidepressant and serotonin. There are 4 types of disorders related to OCD. First is the trichotillomania or hair pulling disorder that is related to aspect of compulsion. In this related disorder, you have a strong urge to pull the hair from your head, eyebrows, eyelashes, or elsewhere on your body. Another disorder is excoriation, also known as skin picking disorder. It is a condition in which a person picks at their own skin repeatedly, resulting in scars. Then the hoarding disorder. It is often accompanied by obsessional fears of losing items that may be needed one day, and excessive emotional attachment to object as an act of compulsive needs. People affected by this disorder will tend to experience high anxiety and depression. Lastly, the body dysmorphic disorder that concern imagined imperfection in appearance that is minor and are not visible to others. This condition includes maintaining or checking your looks on a regular basis, as well as mental activities such as continually comparing your appearance to others. Coming to why these disorders are related to OCD, because it involves the obsessive thoughts and compulsive behaviors. Trichotillomania and excoriation involves compulsion that is forcing yourself to act on repetitive behaviors in response to obsessions, such as picking your hair or your skin from your lips or picking pimples and so on. As for hoarding, it is related to obsessive thoughts where later leads to compulsion on repetitive act to store your old unused items or might even be as simple as an old email. Same goes to body dysmorphic disorder that is related to obsessive thoughts about your appearance which later leads to compulsive acts to check on yourself. As a closure, I would include why an infographic poster can raise the awareness of mental health. As we are living in active media time, this poster could be easily shared through various platforms that can be reached by anyone at a short amount of time, which leads to information on this disorder spread to the public and hopefully could be the cause to early treatment or to patients of this disorder before it begins to worsen and make life narrow for them. That's all from me. Thank you for giving me your time and have a nice day.